Davin Lim, dermatologist. Today I'll be talking about how to improve your neck. We'll be talking about neck rejuvenation in various methods, including home use, home devices, as well as in-office devices. So when we talk about neck rejuvenation, there's basically three things. First of all, coloration of the neck. When someone ages and there's photo damage, in other words, sun damage or UV damage, the area of the neck, chest and décolletage can change color. So it goes from white to mottly. So you can have mottly, which is mostly red, or you can have mottly brown or mixture of red and brown. That term is called poikiloderma. It's a big word, but basically means there are areas of different color changes within the background or original color, which is basically white. So how do we treat poikiloderma? How do we treat colored change? So first of all, we can use IPL. IPL stands for intense pulse light, which is also known as BBL, which is not Brazilian butt lift, but actually broadband light. So these are older devices, but they work really well because what they can do is that they can blend your skin nicely because they've got a big footprint. From there, you can do what's known as vascular lasers. So vascular lasers, as the name suggests, are really good for treating red. It is much like BBL with a red filter, however, the footprint is smaller, which means you may have areas which are skipped or reticulated or checkerboard in shape, but that can be blended with further use. Now, the third laser that we use is something called fractional laser, and the most famous is the Fraxel 1927. So a fractional laser can help treat both red and brown and rejuvenate the neck. So we talk about neck rejuvenation, color changes. Now, neck rejuvenation, wrinkles. What can we do to treat wrinkles? Wrinkles can be treated using things like chemical peels. So if you want to do a DIY or do it yourself at home peel, start with something really sensible, like glycolic acid, 10%, or trichloroacetic acid, 8%, maybe 2 coats. Anything higher than this, you should realistically see an expert because the neck is very unforgiving, especially when it comes to chemical peels. But if you can tolerate that, then certainly the wrinkles on your neck can improve with that. Now, do microcurrent devices work on the neck? The answer is unfortunately no, especially if you have established wrinkles. Chances are you're not going to respond very well if you have microcurrent devices in the context of neck laxity and wrinkles. What you could do is microneedling. Once again, you've got to be sensible with things. What I advocate is a 0.2 to 0.25 mil roller. You don't have to buy yourself a pen. A simple roller like this can do really well. And what you want to do is stretch the skin on your neck, and you can roll it 2 or 3 times in each direction. Do that every 2 to 3 weeks, and hopefully those wrinkles will settle. You can add DIY skincare, so something like retinol or retinoid, and then even an AHA or alpha hydroxy acid lotion or serum. Now, for those of you who have established wrinkles, we're talking about deep wrinkles, there's a few things we can do. Your dermatologist may elect to use certain lasers. So we talked about Fraxel laser, but certain lasers that are more powerful, like the carbon dioxide laser or the erbium laser, can do wonders for wrinkles on the neck. So the downside about laser treatment is that they all have recovery. And the recovery may range from 2 days all the way up to 12 days. Once again, that's based upon the thickness and the depth of your wrinkles. Other treatments that can help with the neck area include injectables. So injectables, the most famous is dermal filler, because dermal fillers can rehydrate your dermis and they can reduce the amount of wrinkles. The different types of dermal fillers include your HA fillers, which are your hyaluronic acid fillers. And within those, you've got traditional fillers, you've got skin boosters, and then the new ones are called biostimulatory fillers. These fillers, as in the last one, biostimulatory, also restores your fat cells, so your adipocytes, and also the top part of your skin, which are the keratinocytes. Plus, they build collagen. Most of us now will probably use that kind of filler. I still do use other collagen stimulating fillers, and they include calcium hydroxylapatite and poly-L-lactic acid. Fillers are really good because, like I said, they do not have any downtime. So most of us have gone from the traditional way of using big lasers with long downtime to to using fillers which stimulate your own collagen. Peels, like I said, we are, I guess, risk averse. So I did used to use a lot of chemical peels for the chest and neck, but that was probably about 15 years ago. I know some people still use it, and they include trichloroacetic acid, usually between 25 all the way up to 35%. Phenol peels are excellent, however, they've got a long recovery rate as well. Now guys, the third thing about neck, and possibly the hardest thing to treat predictably, is neck laxity. In other words, sagging. For that, how we rate it: mild, moderate, severe. So if you have severe neck laxity, there is nothing out there that we can use that's going to guarantee results except for a surgical neck lift. So if you guys got a turkey neck or neck which is basically very loose and saggy, don't waste your time on any devices, creams, injectables. Those are surgical candidates. So what can we do for the mild to moderate laxity? Mild laxity is many things we can use. Like I said, we can use collagen stimulating fillers. The brilliant thing about that, no downtime. We can also use different energy devices. Fractional lasers such as CO2 can contract the skin, stimulate collagen, and can improve mild laxity. Other devices include HIFU, or high intensity focused ultrasound. The most famous, Ultherapy and Ultraformer. These are low downtime treatments which can stimulate your collagen production at different levels, as deep as 4.5 mils or as shallow as 1.5 mils, and it's guided by ultrasound. So they can be really good for lax necks, but once again, mild to moderate. So we talked about HIFU, we talked about lasers, we talked about dermal fillers, and there's another one called RF or radiofrequency. The most famous RF device is called Thermage. Now, how I rate RF devices is pretty easy. You can have RF devices which produce a lot of heat over a small period of time, something like radiofrequency microneedling, and that's where your Infinity, your Genius, your Morpheus 8, your Intracell, your Intensive, your Secret, your Profound RF, they are all grouped in that microneedling RF. Now, the downside about microneedling RF is that you will need several treatments, anywhere between 3 all the way up to 6 to 8. Now, those are fast heating RF. Slower heating RF devices, for example, New Era, Tempura, Pelave, they all produce heat through resistance, but that is over a period of minutes rather than less than 1 second. So I prefer slower heating devices. The reason being is that I combine slower heating devices with other methods to stimulate collagen. So for example, RF New Era, I might combine that with a biostimulatory filler, something like Profilo. And if there's any changes in the top surface of the skin, I may combine that with a low level laser, something like Fractional, or if there's a little bit more damage, I might combine it with something like CO2. So guys, those are the most important things when it comes to neck rejuve. The big question is that, can skincare be effective? The answer is straightforward, is no. The reason being is that skincare has a very important role in preventing sun damage, in preventing or reducing laxity. So all the things include your antioxidants, for example, your vitamin C, ascorbic acid, your ferulic acid, your tocopherol, which is a vitamin E, and a whole heap of antioxidants can help. Then you want to stimulate some collagen. As your collagen depletes every year, you lose about 1% of your collagen. You can help that by using certain actives such as ascorbic acid, but importantly, your retinol or your retinoids. Most importantly, your sunscreen. So how I would grade all of this is that if you're really after neck rejuvenation, stick to the procedures. Skincare is very, very effective in reducing or preventing wrinkles, laxity, and pigment. So this is the best of both worlds. You incorporate procedures together with skincare. That way you can get more accurate treatments that work. Guys, I hope you like that video. It's a short one, but summarizes all the treatments. Please like, share, subscribe, chime your thoughts below. Catch you later.